And I'm excited to introduce to you our next speaker. Dr. Karl Ulrich Volz received his dental degree in Ulm, Germany. He is founder and former president of the International Society of Metal-Free Implantology and founder of the dental clinics Bodensee, Zahnklinik, and Tagesklinik, can't pronounce it too well, Konstanz. In 2001, he developed the first market-ready ceramic implant, and he also developed all of the SDS Swiss Dental Solutions implant designs. They have the best-looking booth out in the foyer. He currently leads the biological dentistry department in the Swiss Biohealth Clinic in Kreuzlingen, Switzerland, and he's performed over 20,000 implantations using ceramic implants. Please give a welcome to Dr. Volz.
Thank you very much to the committees of the 4 organizations for inviting me to this amazing conference, and I feel very honored to speak here in Dallas. And on both of the screens you can see several hundred panoramics, X-rays, and all those cases. It's some of the cases we did the last years. There is not one root canal tooth left. Since 25 years I do remove in all my patients 100% of all the root canals. So I'm very happy about the talk of Dr. Blanche. It was a perfect preparation for my lecture. And as well, we call it breakfast included. We do always in all our patients all the cavitations, and there is no more metals inside, all done with ceramics. So I'm excited to talk about immediate replacement of toxic root canal treated teeth by zirconia implants. And but before we go to start, I want to talk a little bit about causes for disease. And at the moment everybody's talking about the virus, even they have shut down whole countries in Europe like Italy, and in Europe all congresses are cancelled in the meantime. So, but if we have a closer look, we can see that mortality is especially, it's the elder ones in our population, and this is absolutely perfect according to the idea of the top Harvard professor David Sinclair, who is doing a lot of research about aging, and he's telling us that there is not many different diseases. There's just one disease we have to take care of, and this disease is called aging. Because all diseases, they are becoming more and more while you age. So for example, if you would smoke, you increase your risk by 5 times for cancer. If you turn 50, you increase your risk for cancer by 100 times. If you turn 70, you increase your risk for cancer by 1,000 times. And we see that especially those patients who already have existing condition of disease, they're more in risk than the others. And if we have a look at this new study, we can see it's from 2019, so it's top new study. I'm just going to show very new studies. We can see that aging is the most important single risk factor for many chronic diseases such as cancer, metabolic syndrome, and neurodegenerative disorders. Targeting aging itself might therefore be a better strategy than targeting each chronic disease individually for enhancing human health. So that's a very interesting concept. And if we have a look at heart diseases, we see it's the elder ones, they're more affected. If it's metabolic syndrome or diabetes, it's the same. In Alzheimer's disease, it's the same. It just starts in the age of 60, but then it goes up exponentially. And it's the same with cancer. We see if you might, from the age of 70, 75 on, it declines again. So that's very interesting because it helps us just to focus on one disease, and this disease is called aging. And this is a very interesting graph. And if you have a look at the scale down there, of course, we want to stay healthy and young because it decreases our risk for any disease. And it's about the telomeres and about the mitochondria function, many other things. And for that, we have to address the epigenomes and the sirloins, the mTOR targeted of rapamycin. And there are, of course, some different drugs or supplements like NMM, what is the precursor of NAD, or other things you could take to activate the epigenome, what is kind of emergency program to rewrite our DNA. Because what is very interesting, if you clone, like in the sheep Dolly, the always interesting is that the clone is always young. Even if you take a cell from an old individual, the clone is always young. That's very interesting. That is, so it's just a loss of information. It's not that over the years our DNA is not working properly. And the interesting thing is that we could activate this survival mechanism by little stress, not 24/7 stress, because then the healing, the immune system, everything is shut down just by little stress. And that is what you can see up there on top is fasting, intermittent fasting, and therefore as well activate the autophagy, and as well by exercise, as well by heat like sauna, and as well by cold like cryotherapy, or at least having a very cold shower in the morning. So that's very interesting, and we should take care, mostly we should take care about our bio-age and about not aging, because the older you become, I'm just talking about the bio-age, not what is in your passport, on your ID. That means the risk for any disease is becoming bigger and bigger. And you could see if to go back. So aging is caused by stress, chronic inflammation, and oxidative and nitrosative stress. So we see in veterans, for example, that there is a faster aging. We see as well chronic inflammation, accelerator of biological aging, and we see the mitochondria function goes down, the telomere length goes down, and as well this study. So you could see all those studies there between 2018 and even 2020. They are top new studies. We see the source of chronic inflammation in aging results, combination of environmental, genetic, epigenetic factors, and where we create a pro-inflammatory situation. I'm going to talk about that in a few minutes. And so the next study shows that emotional distress speeds up cellular aging, chronic stress accelerates premature aging by shortening the DNA telomeres. So that's very interesting. You will see later that we have performed a study about, so we call it actually the Dallas study, because when I was invited by Dr. Fischer in last summer to talk at this conference, we started a study to at least begin. I'm going to show you later the first results about scientific proof that by removing the root canals, we are going to improve the bio-age of the patients. And another study, it's even, you could see 2020, it's just a few days, few weeks old. This study shows that the hyperactivation of the sympathetic nerves causes depletion of melanocyte stem cells. That is, I mean, we know by experience and by anecdotal that stress causes faster graying of the hairs. And this is something when the soldiers after the Second World War came back from the war, most of them, they had gray hairs. But the interesting thing is when they had been treated with first cocaine, but this made them addicted, and then with Procaine. It was Professor Aslam from Bucharest. She performed a study on 18,000 patients, and she could show and prove that by every single day treating those soldiers with Procaine, they went back to black hairs. So because what is the Procaine is causing parasympathetic mode and is stopping the sympathetic mode. And so that is another interesting study, and it shows that the oxidative and nitrosative stress is causing cancer. That is something we know for many years, but this is something you should keep in mind because I'm going to talk about that later. So now let's talk about the sympathetic mode and about chronic inflammation, because sympathetic mode over the time could cause chronic inflammation, and vice versa, chronic inflammation could cause sympathetic mode. And we know that in the sympathetic mode, everything is shut down because it's just about flight, hide, and fight mode. Makes no sense to waste any energy for the for healing and for the immune system. And you know it takes a lot of energy when you've been with a flu and with fever. You do not want to move at all because you need all the energy for the healing. So that is why the sympathetic mode is shutting down everything, not to waste energy. But most of us, we are in those days, we are living 24/7 in the sympathetic mode, and that is the cause for chronic inflammation and the cause for premature aging, and aging is the cause for all chronic disease at the end. So a healthy reaction means that it would, of course, acute inflammation would cause a sympathetic activity to fight the pathogen, but then sometime later, it's all shut down and the immune cells are going to control the inflammation, and it won't be any more burden to the body. But in chronic inflammation, it's totally different because there's a permanent activation of the sympathetic mode all the time. And so the fine-tuning kind of all the time, the fine-tuning is kind of collapsing the nervous system, and the chronic inflammation condition means that the immune cells are activated permanently and the catabolic process is maintained 24/7. It's a kind of a vicious cycle because the sympathetic mode maintains the chronic inflammation and the chronic inflammation maintains the sympathetic mode. The result, we know, is not very healthy for our system. So in general, there are three main causes for stress/inflammation. We have to understand that chronic stress and chronic inflammation is more or less, it's the same thing, and it's the cause for all chronic disease. The first is emotional stress. We have seen the studies, we had a new study, emotional stress could cause parasympathetic mode 24/7, and we see in nearly all of the cancer patients that they have got some emotional issues, if it's a divorce or financial issues whatsoever. The second is EMF. I'm going to talk about that later, especially since we're now living mostly in 5G. And the third are the oral interference fields such as metals, as titanium, as root canals and cavitations. And but let's talk a few minutes about EMF, because I think that's quite important to understand what's going on. And I mean, we're talking about chronic disease at this conference, and so since the EMF is causing a pro-inflammatory situation, we need to talk a little bit about that. There's the European EMF Guideline. They're most Germans, and actually I know most of the authors, and it shows that EMF has a strong correlation to most of the chronic diseases, and we can see that strong EMF causes a flu-like symptoms. So that's very interesting. You will see on the next slide connection. and as well, of course, it has an influence onto the oxidative and nitrosative stress. The next study I'm going to show, very interesting for dentists. It's a brand new study as well, published last year, peer-reviewed, PubMed. It's a top scientific study, very interesting, that cell phone radiation affects the bone-to-implant osseointegration. That is the reason why in our clinic, and this Tagesklinik, we have isolated the whole clinic against EMF. We've got no Wi-Fi. For the patient, it's not allowed to use the cell phone. They even have to shut it down and not use the cell phone and Wi-Fi for 2 weeks post-surgery. And there's a very good reason for it, because you could read at the bottom, implants exposed to cell phone radiation showed more inflammatory reaction when compared to the non-exposed implants. So that's very interesting, and that is something we have to take into our protocols. The next thing is quite interesting, because we have seen that the virus started at Wuhan, and just in Wuhan there are as many 5G cell towers than in the whole US. And what is very interesting, that some observation shows that those patients who went back home in their houses, they recovered much quicker than the other ones who spent time at the hospitals, where is everything connected with 5G. And we know that EMF is leads to a release of interleukin-6, so the patients will be in a kind of a pro-inflammatory situation, and as soon as there comes up infection like a virus or maybe like the regular flu, it's what we call a cytokine storm, and so it becomes much harder for the patient to fight the flu. So that would be the first thing. So it's much worse in Europe at the moment, and in my clinic we have set up a kind of emergency plan, and for our employees it's not allowed anymore to use the iPhone, and they should stay away from any EMF fields. That is one of the best protection as well, by getting the vitamin D3 up, and as well by having maybe some vitamin C infusions and much more. Very interesting graph is this one. I'm showing the graph since 10 years. There's the reason for it, because it's already almost 20 years old. It shows that Swiss doctors, they have been very successful in getting all the chronic diseases down, but just until 97, and then everything went up again. So all the huge effort was for nothing, and this was exactly since the beginning of the nationwide cellular service, and it's going up exponentially. And in Europe at least, it will hit the 100% mark in about 1 to 2 years. I mean, you might say, okay, it's still just 70% of the Americans are affected by chronic disease, but 70% is a lot. And I would like to ask you to raise your hand in case you're not affected by any disease, not by any illness, no pain, no migraine, no back pain, just nothing. You're 100% healthy, so please raise your hand. 100% healthy. Okay, look around. There is 1 or 2 or 3. So like, should I raise my hand or not? Something like this. So maybe 10%, because the others might be shy, and you're the elite of the elite. I mean, you're medical doctors, you're dentists, and you're coming to this conference because you're taking care about the cause of disease. So biological physicians, biological dentists, you're the elite of the elite. There's just maybe 5 or 10 hands, maybe even 10%. It would be normal that 100% would raise the hand. So that would be the normal situation. And we are all affected by chronic disease. That's incredible what's going on. And so that is definitely something we have to take care of. Okay, now let's have a look at the 3 most important intraoral interference fields, because as you definitely know, but I'm going to talk about it in a few minutes, it's very important what's going on so close to our brain in the middle of our face. One is the cavitations, so it's kind of a bone infarct, a fatty degenerative situation, mostly in the wisdom teeth areas, and we can see that is the green spot, that the Rantes chemokine is very high and even higher than the values in the tissues like in breast cancer. But I'm not going to talk about that. That is, so my dear friend Hans Lechner has done amazing research and studies about that topic. I could just talk for 2 days about cavitations. The second thing is metals, like heavy metals, like amalgam. So I did my doctor's thesis about amalgam 30 years ago. But as well, the titanium, it's not the fault of the titanium industry. It's the fault of the cosmetic, of the pharmaceutical industry, of the nutrition industry, because we've got titanium oxide everywhere, even in the mozzarella. And so it's very interesting that the World Health Organization rated last year titanium oxide as causing cancer. France reacted and is not allowed to use any titanium oxide since this year, January 1st. And as well, from the 13th of November on, the FDA started to investigate about amalgam and metal-based implants. So it's very interesting what's going on. And we have to know that if you would use your cell phone on your face, what I would never recommend to do, try to stay as far away as possible from your cell phone. I mean, we are talking about the first dentists performing X-ray. At this time, they were holding the film with their thumb, and all of them were suffering from cancer on their some years later. And that does not mean like in X-ray, if you can't feel it, if you can't see it, that there is no damage. There is a lot of damage because of EMF. And if you hold your iPhone or smartphone, Samsung, on your face while you're taking a call, it's going to heat up the bone around the titanium implant by 4 degrees Celsius. But this is just regarding 3G, 4G. I have no numbers, no values about the 5G. It might be even stronger. But today I'm going to talk about root canals. And I mean, you see a healthy tooth and a root canal treated tooth, and Mother Nature gave us an amazing instinct. Why did Mother Nature make the fruits, the vegetables, and the berries so with beautiful colors? And it tastes wonderful. The smell is beautiful. Why? Because Mother Nature wants us to eat those fruits and berries and vegetables. And so we should definitely stay away from something that looks like shit, smells like shit, and tastes like shit. It's just, I mean, that's our basic instincts. So, and we know and we have seen the mechanical limitations. The dentin tubules are about 2 to 3 microns. The bugs are 0.5 to 1 micron. They would easily fit into the dentin tubules, and the macrophages which would kill the bugs, they're about 20 to 25 microns. That is like the cat and mouse play. They're sitting in front of the hole and cannot kill the mouse. And that means that the bugs, they replicate and they produce endotoxins, and they produce mercaptans and thioethers. And so there's a mechanical limitation. It could not work. And actually, we dentists, we are the only medical doctors, they would leave a dead organ in the body. So that's ridiculous. And sorry, I was too quick. There's a study, it was published, I think, in 2017-18, increased root canal, I can't read it. It's too small. Anyway, it shows that those root canals are causing oxidative and nitrosative stress, and we know that is one of the causes for cancer. So that is something we should take care of. Another thing are the titanium implants. They worked pretty well for many years, but since our environment changed a lot in the past 20 years, it has become difficult, and we know there is inflammation induced by titanium particles. They kind of activate the macrophages. they release tumor necrosis factor alpha and interleukin-1 beta, what leads to systemic immune processes, and it leads to local immune process, the activation of osteoclasts. And how do you call the activation of osteoclasts around the titanium implant? Perimplantitis. And we know that in the average, after 5 years, 50% of all titanium implants are affected by perimplantitis. That's nothing else than a titanium intolerance. And on most of the orthodox dental conferences, they're talking about 50% about treating the perimplantitis. And they call in the meantime the perimplantitis tsunami because there's something really big showing up. And how does the treatment of the perimplantitis look like? They open the gum and they clean the infected implant with a titanium brush, and they shape down the threads of the implant. What is that meaning? Even more titanium particles. And that is why it never ever worked, because it's like you would pour fuel into the fire. You could treat it from the inside out if you want to keep the implant by installing high doses of vitamin D3, 20,000 units per day for 4 months, 6 in the morning, 6 in the evening of omega-3, and to block the osteoclasts, aspirin, 325 milligrams for 3 months, and the bone is back. And it's kind of cured. We're now going to start some scientific studies about that. And you see, that's a new study as well, 2018, that those titanium particles around the implant, they are not just while you insert the implant, but it's as well because of the micro leakage. So because the implants, the titanium implants were so ugly, so they placed them on bone level, and then on the implant they placed an abutment and crown on top of the abutment, and we know there's a micro leakage between the implant and the abutment, and so there's all the time what they call biocorrosion. So in the presence of the saliva, all the time there is a release of titanium oxide, and that is causing the chronic inflammation. And so that is something we should never forget. So I'm very happy that Dr. Blanche was already talking a lot about Weston Price and all the other pioneers in biological dentistry. And I mean, he showed the proof that the root canal 3DT, so I'm going to shorten it a little bit, is a cause for many systemic disease, since he implanted, when he removed the root canal 3DTs, of course at this time the patient had different illnesses and diseases, more like arthritis, but most of them recovered. Then he implanted those teeth into sheep and rabbits, and more than 80% developed the same symptoms than the donor. So that was very interesting. And as well, he's the founder or the inventor of vitamin K2, MK7. He just had a different name. He called it Activator X. And it took until 2006 until Christopher Masterjohn matched the studies of Weston Price with the studies of Tufts University, and I found out that actually Activator X is nothing else than the good old vitamin K2, MK7, the menaquinone 7. So now let's see some correlation, and we see there is increased levels of oxidative and nitrosative stress. That is a study I already showed. This is a study of Hans Lechner that shows correlation between root canal treated teeth and systemic disease. Another study shows the endotoxins could cause systemic complications, as well increased risk for developing coronary heart diseases. And latest studies show that in about 85% of stroke and heart attack, the pathogens are the same than from the periodontitis and from the apical periodontitis. And so that is why more and more cardiologists like Dr. Levy, who is going to speak in 2 weeks at our education center in Switzerland, or Dr. Laihibero from Sao Paulo, are more and more fighting against root canal treated teeth, because they know that this is one of the main causes for any heart disease. And you see there's some more studies, association between systemic diseases and apical periodontitis, and you could see they're all brand new studies. And of course, those studies are not performed by dentists, they're performed by oncologists, by immunologists, and so on, but not by dentists. They just ignore the whole thing. But we should do it better. And of course, there's another study that shows that implant failure is quite often related to root canal treated teeth. And that is why it's a policy in our clinic that before we place an implant, we clean everything 100% from all metals under high precautions measures, and remove all root canal treated teeth, all metals, all titanium implants, all leftovers, all cavitations at the same time, to kind of unleash the immune system, that it would be able to heal the patient at the end of the day. So we know that the fundamental significance of the oral cavity, about 70% of the chronic disease are related to the oral cavity. Why? One is because the dentists are working in the area of the nervus trigeminus, and the nervus trigeminus occupies about 50% of the space of all 12 brain nerves. So we have got 12 brain nerves, but just the trigeminus is about 50%, occupies 50% of the space in the brain. And as well, 75% of the information is passing through this area. It's very close to the central nervous system, and most of the sensory organs are very close to the oral cavity. As well, the meridians which are running through all teeth, they're not running on the back of your head or maybe on the side, they're running through the teeth because they need the activation of the 15,000 contacts per day. So this is like you would do all day long acupuncture, acupressure while you are biting, swallowing, whatsoever. That's activating the meridians. And that's the reason why nature has put the meridians in the area of the teeth, and they are related to all organs. So that is why there's another relation, and as well there is an interference, a very strong interference between the oral and the gut microbiome. That is something what we have to take into account, that we are talking a lot about the gut microbiome. It's extremely important, and we know that part of the brain is not just located in the skull, it's located in your gut, and we call it the brain-gut axis, and it's connected through the longest and thickest nerve, what is the vagus nerve, parasympathetic nerve. But it's most important to know that the oral microbiome is highly affecting the gut microbiome. So it's very difficult to heal the gut microbiome without addressing the oral microbiome first. That is something we have to respect much more. So now I'm going to talk about our treatment protocol. We are starting with immunological pre-treatment in our patients. That means we are preparing the patients with a very high doses of supplements, because if you want to build a house, you're going to need bricks and concrete. If you want to build bone, you need minerals and vitamins. And so this is something we have to prepare the patient and build the patient up for the surgery. And we go for very, very high doses for 1 month prior to the surgery. But nothing could go wrong if you go just for 1 month. We call it, in the worst case, it would be expensive urine, but nothing is going to make things worse. And we are improving the immune competence. We are speeding up the bone healing. So that means that we do not touch any patients without showing a level of at least 17 nanograms per milliliter. And as well, they should reduce their LDL level to 1.2 grams per liter, because a high LDL is showing a very strong pro-inflammatory effect, and that is something we definitely do not want to see in our surgeries. There's even a quite new study performed in 2014 by Chokroon, the inventor of the PRF, the platelet-rich fibrin, those very nice membranes. And he's together with Curie, and vitamin D efficiency slows implant osseointegration and increases the risk of graft infection. And but anyway, we do not use any grafts. We use biology, and we use autologous bone collected from the patient. So I was very happy to hear that this is not so safe, because we would never use it. So that is just a quick view on our schedule for the patients. So that's the moment of the surgery. They have to show up at the clinic at least 1 day before and to stay for 5 days altogether while we're performing the so-called all-in-one concept. And they have to avoid and to follow, for example, animal protein, and they have to follow a strict nutrition 2 weeks before and 2 weeks after. Of course, we always will ask the patient to follow this kind of nutrition for optimum would be lifelong, of course. That is kind of showing what's going on during the 5 days, and the red and blue boxes is the dental treatment, and all the other boxes is the medical treatment. So in our clinic, on the left side, we've got the dental department, on the right side, we've got the medical department, but it's both under the same roof, in the same building. And I think that is a concept of the future, that we should much closer work together. So if you are a physician, please go and find a biological dentist. If you are a biological dentist, please go and find a biological physician and work closer together, because I think a lot of problems we are facing today is because we have kind of built a Berlin Wall in between the head and the rest of the body. This is something like Lechner in his lectures, always his last slide is, we need more medicine in dentistry, but we need more dentistry in medicine. And so I'm very happy that I'm already the second dentist who is talking about what's going on. So this is actually one of my favorite slides. I'm going to tell you when you should take a picture. So we are preparing our patients with 20,000 units of vitamin D3, and in the presence of magnesium double plus. So it should be not elementary magnesium, but magnesium citrate, for example, because you need the 2+. It's going to change the vitamin D3 into calcidiol, the storage form of the vitamin D3, and then again in every cell in the liver and in the kidneys, it's becomes the calcitriol, the hormone, what is kind of a master key to 2,000 genes, and it's very important for the immune system. And even it's at these times, it's very important that you would take quite high dose of vitamin K2, because it activates the NF-κB factor, and therefore it's the best protection, one of the best protections against the flu. The calcitriol is responsible for the resorption and the re-resorption of the minerals, and of course it is going to lead to higher levels of minerals in the blood vessels. Of course, that is something we do not like to have, because too much minerals in the blood vessels is called atherosclerosis. So that is why we need vitamin K2, MK7, the menaquinone 7, what in former times of Weston Price, he called it activator X. And this is activating the MGPs, what is decreasing the vascular calcium, because we do not want to have too much calcium in the blood vessels. The calcitriol, the vitamin D3 hormone, is in the bone. It's inhibiting the osteoclast, so most important for all dentists, or actually for all surgeons. And it's activating the osteoblast, and you could just exchange osteoblasts by odontoblasts because it's exactly the same in every tooth. That through the activation of the odontoblasts, you could increase the mineralization inside the tooth. We are even able to heal the caries from the inside out. And so we should more and more think more from the inside, not always the threats are always coming from the outside. And so as well, the vitamin C should be between 1 and 10 grams. It's going to activate the osteoblasts, inhibit the osteoclasts. And so if the osteoblasts are activated, they're going to synthesize osteocalcin, which will be activated by the K2, MK7, and this is going to lead to an increase of the calcium, so increase of the bone formation. And so now you should take a picture. So now that's the perfect moment. So that's my favorite slide. It took us even several days to work on this slide because it shows all the interaction between we call it the Fantastic Four. Of course, there are plenty more, but those are the most important. And you see, as soon as we take something away, like the K2, MK7, everything breaks down. Then we take away the vitamin D3, then we take away the vitamin C, and there is the osteoporosis and the arteriosclerosis. Because ladies suffering from osteoporosis, they do not lack calcium. If you supplement calcium in those ladies, you increase the risk for heart attack by 600%. You could read that in the Rotterdam study. And because they're not missing calcium, it's just in the wrong place. It's in the arteries. So that is why it's called arteriosclerosis. You have to get it back from the blood vessels into the bone, and you could even reverse it. As well, for the dentists, it's causing periodontitis, and we know the latest studies show that periodontitis is not caused by poor hygiene. We stigmatize our patients. If we think in this way, it's caused by lack of vitamins like D3 and K2 and C, and it's causing a chronic inflammation, and of course a chronically inflamed gum is causing pain if you touch it with a toothbrush, and that is why the patients, they do not clean anymore properly, and that is causing the dirt. So the dirt is at the end of the domino effect, it's not at the beginning of the domino effect. And as well, it's the same with a caries, so at least at the beginning of a caries, you could reverse it by improving the level of vitamin K2, MK7. So we call it the all-in-one concept since we do everything in one day. And the treatment idea is that we would have a quick relief of the immune system because many of our patients, I would say 99% of the patients, they are referred from all places in the world to our clinic. They are with cancer. We've got a lot of ALS patients. So one of our related doctors, Dr. Mutter, is receiving 80 new ALS patients per day, not per year, per day. And they have no time, so we have to go forward, move forward as quick as possible. And we want to have a standardized treatment and a very safe situation. So coming from a situation like this with a titanium intolerance to this within 8 hours. And the problem with about 100 years ago and maybe even 10 years ago was that we knew since Weston Price that we should remove root canal 3D teeth, but we had not a solution. And now we've got a solution, the ceramic implants. We are now working with ceramic implants for 20 years. And in the meantime, a lot of studies and the consensus conferences, they say that they're at least as good regarding the bone instability, but way better according immunology and aesthetics and soft tissue reaction. And of course, it's nice to have a metal-free material without any free electrons. But for me, actually, the most important thing is that it's the only material known in the world which connects to the gum. And we have to take into account that is an immunological door. That is, if the gum is open, like in periodontitis or periimplantitis, or even in healthy titanium implants, it's not connecting with the titanium, The gum is the ectoderm, what is related to your skin, to your gut, and the bone is belongs to the mesoderm, and that is related to the inner organs. So if the gum is not closed, and the bugs could attack the bone right away, this is kind of like a Trojan horse, and that makes it so dangerous. So that is for me the most important property on ceramic implants, on zirconia implants, that it's closing the immunological door because it's connected, and we call it epithelia, zirconia connection. So in medicine, we say we have to observe, then we have to recognize, we have to act, and later then comes the proof. That was my first case I performed in 2001. My first big case was at this time, then was prototypes, but when I placed the first crowns, I could see the aesthetic result was just amazing, incredible, totally different than what I had seen in 12,000 titanium implants I had placed until 2000. So that's a thing I have to work on my karma, of course, because of that. So this is the same patient in 2001, and you could see we had some receding gum in the middle implant, but the patient did not even know. And in the meantime, we have learned how and where to place the implant to not to lose any soft tissue. But on the other two implants, we gained even some soft tissue, and that's the same patient in 2019. So you could see 2019, and the implants are all still in place. So we have got a lot of long-term results in the meantime. So I even in 2017, we published and I performed the largest immediate implant study. It's even the largest regarding titanium implants. I placed 112 immediate implants within 12 days. And we could see we had an amazing result regarding the bone loss. We had exactly the same bone loss than titanium implants in delayed implantation. Because if you remove a tooth, extract the tooth, and you let it heal, letting it heal means you lose a lot of bone, up to 10 millimeters, and a lot of soft tissue, and you're going to see black triangles in between the teeth, so it will be not filled by the papilla, all the food is stuck in there. So this is actually aesthetic-wise and health-wise not a very good situation. And we gained 1 millimeter of soft tissue in the average, and the so-called pink aesthetic score was 12.3 out of 14. So it was an incredible, amazing result. But of course, to find a solution for the problems we knew since Weston Price, we worked very hard on finding concepts and implant shapes to be able to implant in any extraction socket, because otherwise we're going to lose all the bone, and especially in the upper, you're going to need an external sinus lift. And you know, most of the dentists, they still use bone grafts like from the cow or whatsoever, from other animals. So we don't do that, of course. And as well, we worked very hard on creating a so-called biological drilling protocol, since all the conventional systems on the market, they are putting the highest torque in bone class 1, what is a very purely vascularized bone. Makes absolutely no sense, because it's kind of dead bone, and we know that's the Mamoto's law, that there are pressure receptors in the bone. So if you put a lot of torque in the cortical bone, you're going to destroy the cortical bone. And all systems, they put the highest torque in bone class 1. It's just wrong biological-wise. We've built a completely new concept where we've got totally different drills for bone class 1, 2, 3, 4. So we have the lowest torque in the bone class 1, what is the strongest bone, but with the poorest vascularization. So we tried in any aspects to put biology even into the drilling protocol, and I think that is the reason why we've got an extremely high success rate. So this is the success rate. Last year, 23,000 implants were placed, and the success rate was 97 point something. And if we removed the early losses from the study, it was even still 99.1%. So extremely high success rate. So it works at least as good as titanium, but without the risk for perimplantitis, because 50% of all titanium implants, they are showing perimplantitis after 5 years. Of course, the patient should be having a perfect post-operative treatment with a cooling mask and everything is radiation-free, no EMF, no Wi-Fi at our clinic. And of course, they're getting a lot of instruction for a more healthy lifestyle, because most of the chronic diseases, or like the disease, aging, is caused by a lifestyle. We have to take over responsibility. So we did thousands and thousands of those all-in-one cases, and we experienced amazing results. Like in this patient, she was suffering from Lyme disease and could barely walk, had 2 frozen thumbs, and she was as well diagnosed with multiple sclerosis. And you could see on the panoramic, it didn't look so bad, but on the CT scan, you could see that there was an infection on this molar, on the root canal treated. It was a huge infection in the lower, in the number 31, and very intense cavitations all over. So we did the all-in-one surgery, placed the implants, a lot of PIF membranes around to speed up the healing. And you see there was a huge defect down there. Anyway, we placed the implant in the distal socket. So when the patient came back, everything was perfectly healed. We placed the posts on top, and then the final, of course, metal-free zirconia crowns. But what I like most is that, like we see in all our patients, and we are taking pictures of all our patients before and after, she improved a lot, and she looks like the 10 years younger, prettier sister. And that's her testimonial, and you could see that most of her symptoms cleared up. She could run and walk again, she could move her shoulders, her thumb, the pain was gone in the joints and the muscles, and even her anxiety in the brain, she could think clearer. But this was just observation. And so when I was asked last year if I would give a talk at this conference, we started a project, what we called Pilot Study DDS, or DDS study. And so I'm very happy to show you the first results of this study. And we have put a lot of validated scientific data, pre and post-op, to see if we could show kind of a scientific proof for the improvements of the patients. What we observed, of course, over the past decades, and all biological dentists observed the same. We used the validated so-called medical symptoms questionnaire, where the patient, they just rate their symptoms, if they are frequently or just sometimes, and if they affect more seriously. And so they are going at the end of the questionnaire, there will be a number, and the higher the number, the more severe, the more often all the symptoms. And as well, we are measuring the autonomous nervous system, and the heart frequency should go down, the sympathetic mode should go down, the parasympathetic mode should go up, for example. And of course, we did some lab testing, like the ether mercaptans and the parameters of which we even measured in the lab, the mitochondrial function, and we measured the length of the telomeres, because that shows if the patient has got an accelerated aging, and if he could even reverse the aging. Because, I mean, you could see on the pictures that we reversed the aging, but we wanted to see if we could show it on the telomeres. So regarding the medical symptoms questionnaire, that was a prospective patients we could see so the symptoms and the severeness, the number was much lower. It was very significant that all the symptoms went down in those patients. And I'm going to show you some cases. You see, we have removed the titanium, the root canal treated teeth, and the cavitations, and placed ceramic implants. They perfectly healed, final crowns. That's the final situation. But most important is this: she had a lot of symptoms. So the questionnaire showed a number of 110. That's extremely high. So the maximum you could reach is 140. So she had nearly all symptoms very severe, and about 1 month later, it went down to something like 10. So that's just amazing. And as well, we can see, that that in her case, it was kind of the parasympathetic mode was too strong and the sympathetic mode was too weak. So we can see in a moment why this was the case by looking at this chart where we, sorry, it was too quick. So what we see here is that the interferon gamma, what is kind of the gas pedal and what leads to allergies and inflammations, was very low, and this relates to the very low sympathetic activity and the high parasympathetic activity, and the interleukin 10, what is kind of the brake, was extremely high. So that relates perfectly to the VNS, ANS, and we see post-surgery it's not perfect yet, but the relation between the gas pedal and the brake was in a way better relation than before. Next case, the same, we removed some root canals, all the cavitations, all the metals, and 4 titanium implants. And that's the result. You see the right upper, we're using so-called sinus implants. We are using the biological law of the 10-pole umbrella principle, and we do not use any synthetic or artificial or animal bone grafts. We just use the biological law because we know, like the periost, the Schneiderian membrane is osteoinductive. You hold it away from the bone, you create a stable space, and you're going to build new bone out of nothing. We have proven that 1,000 times, so we could just skip the bone grafts and as well saving a lot of money just by following the biological principles. You see, she had not so much symptoms, but anyway, they went down more than to less than 50%. As well, you could see the sympathetic was very high, parasympathetic low, the heart frequency went down, and so she improved a lot and everything normalized, and you could see that is the mitochondria function, what we measured in her case, and you can see that most of the red areas, they went into more or less neutral, some even became green, so regarding the ATP, it went from yellow to green, so we could show in some cases. It takes some more time, of course, but just in those cases, we could show that they improved a lot regarding the mitochondria function. And the third case, very interesting as well, she went down from 37 to 3 in the medical symptoms questionnaire. She improved the vegetative, the autonomous nervous system, everything was in the green zone afterwards. And now this is really impressing. She was, with the length of the telomeres, she was in the yellow, and there's just 1 month in between, and she is strongly in the green. So it shows that we are able to show and to prove by measuring the telomere length. It was just 1 month after the surgery, not 3 months, 6 months, 1 month. The telomere length improved. And that would mean we are reversing aging. And aging is the only disease we have to take care of, and all the other diseases are in the background. Of course, in cases like this patient, he already was quite nice in the green, nothing changed. So, and as well, we used some retrospective data, and it was exactly the same. So in the average, it was 6 months. We are now running a doctor's thesis about this, and we could show that it's not just a thing about 1 or 2 months. So the reduction of the symptoms, it remains for many, many months. So just to show you 2 testimonials of the patients, and you could see that more or less all the symptoms were gone and they recovered a lot. And so I want to thank our so-called Swiss Biohealth Academy, where they're spending a lot of their time working day and night and weekends, especially in Alpha Dallas, but in general we are performing more than 30 studies at the moment. So head of our medical department is Dr. Klinghardt, you might know him. Dr. Preusler is head of our academy. And so the conclusion is we want to get the interference fields in the oral cavity to be more recognized. Of course, they're quite recognized in this area because I started my first clinic on this side of the lake, and now I'm on this side of the lake in Switzerland. It's a beautiful place. And our study, of course, was explorative, and but it helps to generate a hypothesis for further studies, and we could at least demonstrate huge improvement in those patients. So that was just the first insight. Further studies should include a larger number of patients, longer observation period, and we expect improvement regarding the autonomous nervous system, length of telomeres, mitochondria function, and all those things. And we're going to continue with this basic research, clinical trials. And if you like to know more what we do, we have got a nice education center, completely isolated against EMF, and with very healthy organic food, vegan-free, gluten-free, and sugar-free. And but at the moment, we're more and more focusing on virtual education due to the virus. So thank you very much for your attention.